Today, we're talking about your two brains. Yep, you got two of them. It's a double deluxe, double stuffed, two-pack up in there, one on the left and one on the right. One stuck in trauma and fear, and the other strong and mature. But how do we figure out which is which? And how do we get them working together to help you overcome anxiety, depression, addiction, and PTSD? Here to explain is the father of dual brain psychology, Dr. Fredric Schiffer. So today we're going to talk about dual brain psychology. For people who don't know about it, maybe first you can give a kind of brief overview of what it is.
Sure. So dual brain psychology is a theory that I developed at Harvard over 30 years. I noticed that my patients seemed to have two different personalities. When they came in and they were distressed and they were immature and impulsive and sort of id-like. And as they got better, they became mature and wiser and then they'd regress and they go back to the other personality. And then I started to review these split brain studies from the 1960s in which for severe epilepsy, there was a radical surgery that they performed to help the epilepsy, and it was clinically useful. And they cut the connection between the left brain and the right brain. And each brain hemisphere can support a mind. And what they found when they cut the connection between the left and right brain was that the two sides often disagreed. One woman wanted to wear a dress, and her other hand kept unbuttoning it. And another person wanted to smoke a cigarette, and his other hand kept putting it out. And one interesting story was a man whose wife divorced him because she couldn't tolerate all of his medical problems. And he had a problem one night. He was trying to walk home, and his left leg, controlled by his right brain, kept walking in a different direction. And he finally worked it out, but he was having trouble getting home. And the neurosurgeon understood where his left leg was trying to go, and it was to his former wife's house. So the idea that comes out of the split brain studies is that when you cut the connection between the two halves, you wind up with two minds. And I did a study with the California series, with the split brain group, and I did the first study of a psychological inventory of the two hemispheres. And I asked questions to each hemisphere. How much do you feel happy, or how much do you feel dishonest? And there were positive and negative questions. And the way we did this was if you put the word on the side of a computer screen, it only goes to one hemisphere. And so you can actually simultaneously ask a question to each hemisphere. And we got results that showed that one patient's right hemisphere had a high opinion of himself, and his left hemisphere had a low opinion of himself. And we know that people sometimes have a stroke or cancer in one brain hemisphere, and they can live with one brain hemisphere and still be a human being. And you can communicate with them, but if you remove more than that, you remove the mind, so my feeling was that in split brain patients, you have a person with two minds in one individual. And then I started to think that maybe this had some relevance to my observation of these two personalities that I was seeing. And there was a German group that was purporting to show movies to one hemisphere or the other. And it turns out that it was well known that the eyes are connected to the brain in an interesting way. So that if you hold a picture over here to a split brain patient at the left visual field, and it can only be seen by the right brain. So in one instance, Roger Sperry, who won the Nobel Prize for the split brain studies, showed a picture to the left visual field. The person that you're talking with is the left brain because speech is in the only in the left brain. The right brain can't speak. Uh, and the person said, or it didn't say, they started giggling. And so they asked the left brain, which didn't see the picture, why she was giggling, and she had no idea. And what had happened was Roger Sperry showed to the left lateral visual field a picture of a Playboy nude, and the woman giggled at that. It was in the 1960s, and again, it shows that it's an intelligent mind that has humor and responds and but it's not able to talk, but it can communicate with its hand. It can give hand signals. You can show a picture of a political figure, and it can give thumbs up or thumbs down. And so so this German group was showing a movie, it turned out, to one lateral visual field or the other, and they had this very expensive machine, and they were getting different emotional responses depending on which side they showed it to. And and after I figured out what they were doing, I held my hands up like this, and I was essentially doing what they were doing. And I didn't feel any different, but I went to the office shortly after that, and I asked my first patient to do it, and he was a Vietnam vet with severe PTSD who had been doing quite well. And and he got all upset when I asked him to look out. He was actually looking out the right visual field, which stimulated his left brain. And he said, "That plant behind you looks like the jungle." And I said, "Well, look out the other side." And he smiled and he said, "No, it's a nice looking plant." And that day, most of my patients had these intense responses, and in my practice, about 50% of patients have intense responses. Um, and that would be like on a 10-point scale, they might have like a 5-point difference between their sides in terms of their anxiety. Um, if you want to try it, you could see if you feel a difference. Do you have like a letter envelope or a credit card will do?
I've got a little like this kind of thing.
Yeah.
Actually, I did try it already, and I'm gonna do it again now. And I was blown away by it. It was really clear to me when I covered my left eye, and therefore my left hemisphere is activated. Maybe you can explain the eye thing first, how the eyes are connected to the brain.
You cover one eye and the middle of the other eye. So it's your lateral visual field, and it's just the way the retina is divided. So if you do that and you think of something upsetting, how much distress will you feel?
If I cover my left eye and the left half of my right eye, I'm
Yeah, you're looking at your right visual field.
yeah, then I feel calm, I feel relaxed, I feel okay.
And say from 0 to 10, how much distress do you feel?
Like 2 or 3.
Okay. And try the other side and think of the same thing.
Yeah, no, on that side it's more of like an 8 or a 9 or at least a 7.
Okay. Well, interesting.
Yeah, it's very yeah, and I noticed this before too.
Yeah. And I might look different. In other words, so they're looking at me, I might look hostile or unpleasant, and out the other side, I might look friendly.
Yeah, yeah.
Okay. I'm not aware of changing my expression. And to convince some patients, I brought in a photograph of a man, and he looked angry and displeased with the patient on one side, and happy with him on the other side. And it turned out that it was a picture of Winston Churchill as a young man. So they didn't recognize that it was Winston Churchill, but there's a popular idea about Winston Churchill that he's a friendly person. and and so that there was a reality that there was a photograph and there was that one the side that he was condemning them and maybe Churchill's children would disagree with this, but it was not true. That he wasn't condemning. He was more of an approving person, and and uh, and my own feeling is that I'm not changing my expression, and that I'm approving of the patient, and so that there's a reality that is true on one side, and on the other side, it's the reality is distorted, and it's always distorted in the same way. It's very interesting. It's distorted that there's a child over there who's looking at the world through their trauma, and so maybe there was a male figure or a person who was unpleasant and maybe intimidating, and so I become seen as that person from that mind. The other mind sees me as a helpful therapist, and we use this in what I call dual brain psychotherapy. And so this enables me to talk to two people in one person. And the aim of dual brain psychology is to treat the troubled side, the side that's living in the trauma. And the reality is that the trauma in PTSD means post trauma, means that their perception that they're in danger is not accurate. And so the job is to help teach the troubled side that they're actually safe and worthwhile. Uh, and uh, and that may sound easy, but it's not. It takes a lot of work to convince that side. But we have truth on our side, and 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 the other side of the person is a co-therapist, and so I can lie and I can say the patient's a nice person when I really am contemptuous, and who would know? But the person can't lie to themselves, and when they feel well on the healthy side, that's experienced by both minds, and it's confusing. And patients often say, "Well, what is this?" And what happens is these two minds fight for dominance, and in some people, the troubled mind has dominated their whole life, and one trauma leads to another trauma, and so if I have a lot of male patients for some reason whose mothers said, "You're a loser and you'll never amount to anything," and the kids in diapers, so it's really crazy. And but as a consequence, he'll do poorly in school, and then the teachers get angry with him, and then his peers get angry, and so it snowballs, and then he winds up with a bad group of peers and winds up abusing alcohol and then drugs, and each of these things becomes a new trauma that actually comes from the earlier trauma. But when the person starts drinking or using drugs, they forget about the early trauma and they don't see the connection, and they blame themselves, and they confirm what their mother or somebody said to them, that they're a loser. And the idea that, "Hi, I'm Fred. I'm an alcoholic. It's supposed to make me feel good, but it doesn't. It's a trauma to feel that you have a diagnosis, and I like to say I don't have any alcoholics or drug addicts in my practice. I have trauma victims, and I think that's true. And we don't treat the alcoholism, we treat the trauma, and that treats the alcoholism.
Okay, so the trauma is sort of at the root of all of this of addiction, of anxiety, depression, mental, what they're calling mental illnesses. But I know you don't like to use a diagnosis so much; those tend to cause more problems in the end. And then all of this trauma and addiction and these sort of negative feelings and emotions and things tend to get all stored up and kind of lodged and focused on one hemisphere, and that differs from person to person. But by using this eye test or other visual test, etc., you can figure out if it's your left side that's sort of been traumatized and more.
Right. Right. That's right. So you felt better looking out your right eye, your right half of your right eye.
Yeah.
And so that means that your left brain is positive.
Mm.
Uh, and uh, and I have a device. It's a near infrared light that we put on the forehead, and we put one side stimulates the brain, the other side inhibits it, and we're able to treat depression. And actually, we have a study going on now where we're using near infrared light to simulate the positive hemisphere, and we're treating fentanyl addiction. And I don't have I'm blind to who's getting sham and who's getting active, but many of these patients are doing well. And when you look at fentanyl, it's sort of like treating cancer, and you're seeing good results.
How does this map onto or differ from the, say, for example, the triune brain theory? Because a lot of people are thinking similar, but it's more like the prefrontal cortex, the front part of our brain, is sort of the mature, healthy side, and then you get deeper in there, and that's sort of the where the trauma and stuff is. But now you're turning it to like left and right.
Yeah.
But yeah, how do we explain things like the prefrontal cortex and these lower limbic structures? And
Well, they're still present, but let's say you're looking out your left side. So in each brain hemisphere, we have all the parts of the brain. So we talk about the amygdala. There are actually two amygdalae. There's one in the left brain and one in the right brain, and there are two hippocampi, and there are two everything. Okay? And there are two frontal cortices, so each hemisphere is really a pretty complete brain, and it has each have their own limbic system. And so you're right. The front of the brain can inhibit the limbic system or engage with it, but what we're seeing is that in total, the whole mind that comes out of the brain has different information on one side than the other. And on one side, the person feels that he's a loser, and he may use a lot of his life experiences to affirm that. But looking at the other side, he may have a very different experience. That no, actually, I'm pretty smart, and I like myself. And so, my first book was called "Of Two Minds," and so I think that it's true that aspects of the frontal cortex can inhibit the amygdala, which is sort of the fear center. And we actually have a study from McLean Hospital where we showed that if your left brain was positive, your left frontal lobe had a lot of connections to the amygdala. But if your left brain was negative, those connections weren't present. Uh, we were able to track the connections between the frontal cortex and the amygdala.
oh, interesting. So the connections between the kind of parts of the brain differ depending on which side's more traumatized or which side's more developed or whatever. But also, I imagine, I don't know how you measure it, but are the size of, say, the amygdala or the visual cortex or these different parts of the brain also different?
Yes.
Oh, wow.
And one study that we did morphological. In other words, we measured the volumes of different brain areas, and what we found was that in people who, by a visual test, had a left positive hemisphere, that their reward center, called the nucleus accumbens, was much larger on the left side than on the right side, and it was reversed if you had a negative left hemisphere and a positive right hemisphere, and we also found that with a positive left hemisphere, the amygdala was smaller and the hippocampus was larger. So we actually saw these structures changing with what we call hemispheric emotional valence. So they're actually physical changes that appear to come out of trauma because what I always wind up talking about is trauma. You know, that the side that is more troubled is it's really it's one story for all. that it always goes back to some mistreatment, and and by trauma, it's interesting. It doesn't have to involve what we normally think of as trauma, which would be torture or sexual molestation or blood and gore, and of course those things happen, and I see patients with that. But in a suburban practice, more often it's emotional neglect and condescending comments that injure a person, and I call those traumas. And I think that trauma is whatever harms us and whatever impairs our functioning.
And a lot of these are from childhood. Maybe we can talk about Freud a little bit because one, he put a big focus on childhood.
Yeah,
I guess well, traumas in a way, but yeah,
mhm,
childhood. But also that there's this ego and the id, and it also sounds a little bit like the ego and the id. Yeah, so maybe you could talk about those 2 points about Freud or anything else.
sure. So yeah, I was trained in Freudian psychology. I'm not a psychoanalyst, but I underwent an analysis during my training, and McLean Hospital, where I trained, was psychoanalytically oriented at that time, and all of the faculty, the higher faculty, were psychoanalysts. Today, you can't find a psychoanalyst. You know, you'd need they're just not present at McLean, or if they are, they it's a secret. That there was a revolution that occurred in the 1980s where the insurance companies and the drug companies took over. And I was an attending psychiatrist from the time that I finished my residency. And in 1993, they ended the attending staff, which was sort of like a stable of competent therapists. And we would see the patients 4 times a week, and they put a stop to that. And my understanding now is that there's just an emphasis on medications and medications which, when they're tested, I don't show a great efficacy. And so I think that psychiatry has sort of lost its mind, and it's very sad. Now, but getting back to your point, uh, I was feeling that I wasn't seeing a lot of egos and superegos and ids in my patients, but I was kind of seeing these two minds. But the immature mind was a lot like the id, and the mature mind was a lot like the ego. And so I think that this may be a clarification for psychoanalysis, that a lot of what we're calling id behavior, which is supposed to come up from the limbic system and drive the person, I see it more as involving the frontal cortex that's immature and traumatized. So I think that one hemisphere, and it can be left or right in a given individual, but it stays the same in that individual. So is more id-like, and by id-like I mean the id is described as primitive and immature and impulsive and wants primary gratification, whereas the ego can delay gratification and think through and find more mature solutions. And so I think that it may clarify some psychoanalytic concepts by thinking of the id as a whole mind and the ego as a whole mind. And so a more troubled mind and a healthy mind. And again, it clarifies what the task is. It's to help the troubled side appreciate that it wasn't his fault, that it wasn't a loser, that no child is a loser. And that children have a tendency, more than a tendency, they always blame themselves. Their parents get divorced, they believed that it was their fault. They weren't good enough as a child to keep the marriage together. And and all of these things are issues that need to be clarified and that are kind of id-like. And the two sides can compete with one another. And so I started to mention that. And so you can wake up in the morning feeling depressed and anxious, and then you get a phone call that somebody's got a problem and you want to help them, and your mature side steps in, and the depression, anxiety go away. That's a pretty common experience, I think. Uh, and uh, and then some people are fortunate enough to not have had that much trauma, and they sort of live in their healthy side, and their troubled side isn't that troubled. And the aim of dual brain psychology is to help the troubled side become healthier and it becomes an asset, and and rather than part of you that you want to kill and get rid of because it's destroying your life, that if you help it, it becomes a partner and your best friend.
Yeah. Well, what are some of the benefits of the troubled side? Because you're right. We think of trauma as a clearly bad thing, something we want to get rid of, or bipolar and depression and anxiety as bad things. But it sounds like what you're saying too is like, well, maybe there's some benefits to this troubled side if we're able to work well with it. So yeah, what are they?
Well, it's a whole brain, and if you have two good brains, it's really an asset. And if if you have part of your mind or part of your brain that's trying to destroy you, that it's always in pain and always looking for some kind of immediate relief, and that's what all the addictions are, or compulsions, or even a psychosis is an attempt to relieve pain, to imagine a better world than exists. And so, paranoia has that dual idea of grandiosity that feels good, and then pain that you're being attacked. And so if you're able to help that troubled side appreciate himself and be able to really go, huh, it really wasn't my fault. And I really wasn't a loser. And then it can become a partner. You don't necessarily want it to be in the corner office, but it can be a helpful partner. And it might be better at certain tasks. It might be better at some creative tasks. And the two of you working together is a great asset.
And two computers or two heads are probably better than one, especially if they're both kind of programmed slightly differently.
Yeah, if it's both working well. Yeah.
Yeah. And so, actually, this is really, really useful stuff. I mean, we always are battling with these two sides are kind of battling with one another, and but this gives us a kind of a clear strategy into like how we can better manage those two sides. I know we got to talk to it or whatever. I haven't done that part, but even just I can't walk around with an eye patch on all day or whatever. But yeah, what can the average person do who's not going in like and working with you still do in terms of like using visual tactics, or you mentioned the light also. I mean, we don't have these light machines, but what can we do with light and visual stimuli to, I don't know, maybe help the troubled side a little bit, or activate the more mature side? Is there anything we can do like at home?
Yeah, actually, there's something easy that you can do that is very powerful. And so, if you just hold up a letter envelope, or on the cover of my book, there's a picture of some sunglasses that we have, and so you can wear those and get the lateralized effect. And all of my patients like them and use them. And I also use them in therapy. So if they look out the other side, I can talk to the immature person, and then we can switch and talk to the mature side. And so the therapy session is often switching sides and talking. But what somebody can do at home is just if they get any junk mail, I get a lot of it. They now have a use for it. They can hold it up so that they cover one eye, and the trick is not to just cover one eye. That won't do anything because the eye goes to both brains. In order to stimulate the opposite hemisphere, you have to cover half of the eye that you're looking at, and so it's called the lateral visual field. And then you can go to the other side. Now, what I would recommend is that when you know which side is your better side, and with you it would be the right lateral visual field. Uh, so before you have a stressful meeting or maybe a date or anything that you really want to follow up your mature side with, you can just hold this up until you just get a sense. And this is very quick. It happens, as you saw, in seconds. And if when you hold it up and you get a sense, you know, I can handle this, and I, you know, I'm a good person, and and uh, and I'm okay. I'm gonna be able to succeed here. Uh, it only takes a few minutes to kind of get that, and when you do, it'll hold. So I would say that the listeners can find their positive side. Now, not everybody's going to have a strong response, and about 20% of people, 15 to 20%, don't have any response, and so you're one of the 55% in my practice who had you know huge responses, and another 30% had maybe a 2 point difference, and that's clinically useful, but it's not amazing. Um, but even with a 2 point difference, you can look at that positive side and set yourself. It kind of engages the positive side. So it's not you know going to cure cancer, but it's a big help.
Yes, if you're feeling negative or you're feeling bad or whatever,
Yeah,
you can use this
yeah,
envelope or these glasses that cover up so you only have half of an eye essentially,
exactly.
and then you can just sort of like almost like a meditation or something, just kind of calm down. You don't have to talk to yourself necessarily like the way you're doing it.
Well, and you can talk to yourself a bit. They just say, "No, I can handle this." Try it.
Should I upset myself first?
No, well, you can. Yeah, it's up to you.
It's kind of nice to feel the difference, to appreciate the good side, and then also you start judging the other side less because you're like, well, it's like simple science. I just covered my eye. It's not about me. It's like it's my left eye. It's my right eye. What am I blaming myself for?
And as you're looking out there, just sort of say, can you, when you look out, can you see that you can handle it?
Yeah, I feel much more confident and hopeful and positive.
Yeah, and it will stay.
It's crazy. I mean, how judgmental and negative and down you can get, either down or like manic or what. It's interesting too because you mentioned how psychosis is sort of on one side. I wonder if for people who are bipolar or schizophrenic, for example, how how h- how this explains things like that, or ADHD. I know your book was focusing on anxiety, depression, and addiction and PTSD, but I'm kind of curious about these other ones.
Yeah, we run out of paper. We ran out of paper.
He ran out of paper.
uh, no, it actually, we intend to do some studies for attention deficit disorder. With psychosis, it's hard to treat because the negative side is so strong, and the trauma. They usually have a much more severe trauma, and but the principle is the same, and there needs to be more work done with that. And I think bipolar, I think like a manic state, I think is just like drinking beer. You know, it's trying to find some pleasure, uh, but it winds up like drinking beer. You drink too much, and it gets you into trouble. So that the mind is usually seeking for ways to get out of the agony.
That's interesting. Is also after drinking the beer, you get a hangover, and that's sort of like a depression.
Yeah, yeah, yeah. And especially if you're drinking 8 beers, then and then it becomes a serious problem and a trauma.
How about the light? Can you talk more about the near infrared light that you're using?
Yeah. So it's called transcranial photobiomodulation, and transcranial means it goes through the skull. And I did the first study at MGH using this technique for a psychological disorder, and I worked with Michael Hamlin, who's the world's authority on photobiomodulation, and so essentially you have light waves going through the skull into the brain, and it tends to wake up the mind on that side. Um, in this study that I done, one patient who was very responsive to it, we gave him a depression scale, and before the treatment, he scored 34, which is very high. It's like 20 is like high, and after a single 4-minute treatment, his score was 4, and I think like 15, I think is like normal. And he said, "What is this?" And now not everybody responds like that. He's an extreme responder, but most people like it, and most people feel better from it. And we're using it in what's called a phase 2 study. So we did a phase 1 study for the National Institute for Drug Abuse, and there we were focused on treating cravings, and we had a sham or a placebo device and an active device, and there was a huge difference between the active and the sham device for cravings, and they came in twice a week for 4 weeks. That was their treatment. It's a 4-minute treatment, and it lasted for 3 follow-up weeks. So the active treatment had a 71% decrease in craving. And if you took out the people who were getting Suboxone, which decreases cravings by itself, it was actually 80% decrease in cravings. And the sham had a 35% decrease in cravings, which is sort of what Prozac gets in this placebo. So it's a healthy placebo response, which 35% reduction is good, but it doesn't compare to a 70 something decrease. So then we got a second grant to treat active addiction. And it turned out that all the active addiction was fentanyl. That's the only thing. There's no heroin around anymore. There's no oxycodone. And fentanyl is a very powerful, 50 times more powerful than heroin. And so it's a very hard addiction to treat. And a lot of times the patient wouldn't show up for the appointment. But we finally completed our enrollment at my site. And I don't know who's getting active and who's getting sham, but just with this light treatment with no psychotherapy, about half the people are doing very well. And we're hoping that they're the people who are getting the active treatment, not the sham. But I don't know that. But the fact that a number of people, the top quarter, have a 90% decrease in use in fentanyl dose, and a lot of them went down to zero.
Yeah, and you mentioned how there are different ways to activate the healthy, mature side. We talked about the visual field tactics, like using the hand or an envelope, or the special glasses that you made. But you mentioned in the book that this light therapy is 2 to 3 times more powerful than this pure visual technique. Why do you think that is? Or what's the science behind it? What is the light doing exactly? Maybe we don't know, but you know more than me.
We don't know, and in fact, I'm surprised. In other words, I had this idea enough to try it, but when I put my hands up and I didn't feel anything, I didn't expect anybody to really respond. But when the Vietnam vet, complained that my plant was a jungle, I knew what it was. I knew what it meant, but I didn't really expect it. And I know that the eyes are connected to the brain, but that you'd get such a powerful difference. So, and even in you, that you're seeing a really powerful difference. I can't really explain it except that we're stimulating that hemisphere visually. And we did do an fMRI study at McLean Hospital where we put people in a fMRI scanner. And fMRI measures blood flow in the brain. And blood flow is a measure of activity. And so they're in the scanner with goggles with tape in the middle. And if they look to the left, it occludes their right eye. And if they look to the right, it occludes their left eye. So essentially, it's a way of, without pulling somebody out of the scanner, having them just move their eyes. And what we found was a very bright difference that just looking to the left activated the right hemisphere broadly through most of the hemisphere, and just switching to the other side flipped it, and so that the when you look to the right, the left brain became much more active. So we actually have a scan of 7 people that showed that. We've published that.
Wow. I know we have to cover up the other half of the other eye as well, but it would be really simple if it was just pure like left eye and right eye, because then you can like when I was a kid, I wore an eye patch for a couple years. I wonder, did that eye patch do something to my brain? But also, should I rearrange my desk in my room so certain things are on the right and certain things are on the left? And maybe I don't know how much that would do, like rearranging our environment, because like you said, we have to cover up part of the other eye too.
Some people have commented on that. I don't think it's that strong because each eye goes to both hemispheres, but it goes differently. And there's 60% that goes to the opposite side and 40% that goes straight back. So there's a group in Canada that uses a one eye technique, and I don't know their work that well, but I think that they're not going to get as powerful a result.
Yeah, might be like a small tiny difference, but perhaps.
Well, you can try it. Why don't you look out one eye? Look out your left eye.
Yeah, it's not so obvious.
Mhm.
It's not so obvious. It's like I'm down in that 10-15% of people who don't have a big difference, or maybe if I kept doing it, I would notice it. But like when I do the way you've been telling people to do it,
Yeah.
covering up 1.5 eyes, um, my heart starts beating, my breath changes. I feel it physiologically too. It's like, yeah. And then here, I'm pretty calm. I'm pretty calm. If I just cover my left eye or my right eye, I'm what I am basically. I'm in my default state. Yeah.
And then what we would do in therapy is we would explore where that anxiety comes from on the negative side.
Yeah. How would we do that? You just ask me questions or something, or just talk to me?
Yeah. Yeah. It'd be sort of like a traditional psychotherapy.
And naturally, I think anyone who does this is going to start looking at themselves in the mirror or looking at a human and remembering, oh, we have actually two of not just our amygdala and hippocampus, but we have two eyes and we have two ears and we have two hands and two arms and legs. And it makes you start thinking, is this dual brain psychology or is this dual body psychology? How does this connect with things like the hands and the legs and the ears and the other parts of the body? Yeah, what are your thoughts on like the two sides of the body also?
Well, that's very true. Now, is that the body is divided in half. And if you have a stroke, say you have a left-sided stroke, and it's a profound stroke, the right side of your body, not your left side will be fine, but the opposite side of your body will be paralyzed, and you'll have no sensation. And so that each brain controls the movement and sensation on the other side of the body. And even the vagus nerve has a left side and a right side. It's not as separated as the voluntary system. But you're right. But I think that the most important piece that we have to work with. The most important part of our human being is our mind and our experience. And that trauma is a negative experience. It's painful. So it may affect the body, and it does. So a lot of patients, I give them a light treatment on the positive side, and they'll say my chest pain went away, and I didn't know they were having chest pain. So the mind does affect the body, and I don't think there's any disease that isn't affected by the mind. But I don't think the relationship between the body and the mind is equal. In other words, I think that if you exercise, if you take good care of your body, if you're healthy, it's going to help your mind. Uh, but I think that the mind is the main driver. That's my opinion. That if you feel good and if you appreciate yourself, you're going to help your body.
Yeah, and another question that we can't really answer too, but it's like, ooh, I wonder why we have two brains.
Well, the whole animal kingdom, is divided symmetrically. So the divided brain is present in fruit flies, and it's not present in bacteria or viruses, but that most animals are symmetrical, and whether it has to do with if there's an injury to one side, you have another side to compensate, in evolutionary terms, is there a survival advantage to it? Uh, I don't know. The other thing is, there's a great deal that I don't know about this. You asked about the light. Why does the light cause this great stimulation? I have a I have thoughts about it, and I've written papers about it. I think it has some quantum effects, but I'm not able to really study that and prove it. So there's a lot about this that I don't know. And another question is, why does someone have their positive side on the right hemisphere and some on the left hemisphere? And it may have something to do with the timing of development or the type of trauma, but we don't know at this point.
Yeah. So if all of the animals have these two hemispheres in their brain,
Well, except for the octopus, which has a whole different sort of brain, has about 8 brains.
it makes you wonder, like, how do their two brains communicate with one another? And are they traumatized? Do they like if we think humans are like the rational animal, we've got this like mature rational brain or whatever, which I guess is going to be one half of our brain in general. Um, but then what are the animals? I know that Roger Sperry did some work with cats, but have there been any other
Yeah.
experiments or studies on animals and any of this kind of stuff? Whether it's the split brain studies or it's something that you're doing?
No, Sperry did interesting work in cats and he may have done some work in monkeys. I'm not sure. I don't know of that, but I know what he did with cats was he cut the connection with the eyes so that each eye went to one hemisphere, and then he put a patch over one eye or the other, and he would teach the cat that when an X was shown, to push a lever and he'd get a pellet. And so the cat learned that X meant a pellet, and a zero meant not to push. And the cat would learn that easily. And then he flipped the patch, put on the other eye to stimulate the other brain, and he taught the opposite, so that the O got the pellet, and the cat learned that. And so one brain knew to get the pellet by pressing the zero icon, and the other brain knew to press the X icon to get the pellet. And that was the extent of his studies. So he didn't do behavioral studies, or emotional studies, psychological studies.
Your whole story of how you even came up with this dual brain psychology is also very kind of beautiful and inspiring because you didn't really know for sure whether something would work or not, but you just experimented and like, let's try it. I mean, yeah, you learned about Freud, you studied that, You had some clinical observations. You saw the German studies, you saw the split brain studies, and then you were just like, let's try this eye thing. Let's try this light thing. And like magically kind of worked. So it's like, ooh, it makes you kind of excited. Like maybe I should experiment and try a little bit more. This is beyond just science, but just life in general. Like, huh, maybe this will work. And even if we don't know the answer to the mechanisms behind why it's working, you get closer and closer, and you be getting closer and closer to it too. It's like it started with the vision, the visual stuff, with the envelope, it started with the hand, and the envelope, and the glasses, and now the light, and it's kind of exciting thinking, ooh, what's coming next? I mean, even if this light stuff is, I mean, it's helping people with fentanyl addiction. Whoa, light, and who would have thought? And what's coming next? We don't know, but it's very motivating, regardless of your field or where you are in life. Whether you're a scientist or you're a doctor or you're working at Albertsons or whatever, it's like, oh, this is cool.
Well, one of the things that helped me was that, well, like with the Vietnam vet, I got a profound response in a short period of time. So if I were studying something like Prozac, that you have to wait 3 weeks to see if you get a response, and the response is maybe a tiny bit better than a placebo. I never would have been able to move forward, but I was lucky in that the responses that I got were very quick and strong, so it kept encouraging me.
What are some you're focusing on light right now, and you're still using the visual techniques. What are some other kind of modalities or things that you think, there might be something here? I imagine things like sound, perhaps, or maybe.
Well, actually, I do music in one ear, and that seems to be helpful. So I put it opposite the negative hemisphere. So I'll play some very soothing music, not new age music, a piece by Elgar that I like, and almost all patients prefer it in one ear versus the other.
If you stimulated, say, these people with fentanyl addiction, if you stimulated their traumatized brain, would that increase the cravings?
Uh, well, sometimes we have by accident.
You don't want to play with that, but yeah.
Well, but it doesn't. And in my practice, sometimes I'll stimulate the negative side, and doesn't. It creates maybe their usual state. It doesn't. I haven't seen it. Create a catastrophe, and we don't intentionally do that with the fentanyl patients, but sometimes we've confused which side the eye thing was on, and treated the wrong side, and we didn't notice any great difference.
Have you seen any of your patients? Let's say they start with a big imbalance where there's a really strong response, and then over time
Yeah.
it kind of evens out to where the trauma is sort of going away or something. Does it ever go away?
Yes. Yeah. It does. With a successful treatment, there's a diminishment of the difference.
So I'm wondering what I should do next. I clearly have a strong response, so it makes me. Yeah, we all have, a lot of us have trauma, so I know I do too. Um, what do I do next? I would like to get rid of some of this, or to feel more in control of my life, not feel addicted to things or out of control. Or sometimes I get a little bit hypomanic or almost manic sometimes. Which is, there's beauties to that, but like you said, I don't know, there's dangers as well. So, uh, do I got to go to psychotherapy or something? What do I do?
Yeah, I think but you have to find a good psychotherapist, who, a lot of psychotherapy today is, just trying to suppress your feelings and have a CBT and that can be helpful. There's a use for it, but it's not going to get to the trauma.
So, what makes a good psychotherapist? You mentioned that, say, CBT or these mainstream practices are not doing it. What would do it?
Well, I think psychoanalysis is good. Psychoanalysis has become too expensive and so impractical. But maybe psychotherapy with an analyst or someone who is interested in psychology, in the psychodynamics of the trauma, and we'll look at your past and talk with you about it. And you might then add the envelope for bring it into your therapy with a good therapist.
I wonder why Freud and psychoanalysis just fell out of favor. Maybe you have some understandings of the historical, cultural, business side of it, or whatever. Why it's so hard to find these people, not only in McLean, but I mean all around the world. It seems, and now it's more expensive as well because of that. What happened? Do you have any idea?
I think that psychiatry wanted to become more scientific and had an inferiority complex. You know that they were dealing with Freudian metaphors and not chemicals and laboratories and I think all of the trillions of dollars that have been spent scanning people's brains really haven't led to any insights. It's been pretty empty. And I think that there haven't been any really useful drugs that have come out of it. I mean, they're the antidepressants, but in actual studies, the antidepressants are equal to the placebo in most studies. And I don't think that the antipsychotic medications, which are very dangerous, are terribly effective. But there was a switch, and it's a lot like in our political arena, you know, that different parties get elected and they change things, and so I saw really a sort of a cultural flip and the people who were the biological psychiatrists weren't the psychiatrists who I knew and liked. They were brought in, and the insurance companies liked the idea of giving medicines and shorten the stays and to save them a lot of money. Um, it didn't help the patients.
You pointed out the antipsychotics are particularly dangerous. I've been thinking about this a lot myself too. I just came back home for the first time in a few years, and I'm actually in my brother's room. He's not here because he's homeless now, but his room's still the same. It's like a little shrine or something. And I like being in here, but yeah, he stopped taking his medications. But I don't think they were helping him, you know. And then my younger sister's on them, and she used to be so skinny, and I didn't recognize her. She's massive now. Now that she's on, they're both were taking Abilify, and she's massive, but she's calmer and she's more sociable and stuff. But she's huge.
Yeah, and the side effects are profound. They cause heart disease, diabetes, obesity.
Yeah. I'm kind of worried. Yeah, maybe she's not screaming around the house anymore, but she doesn't look healthy. That might be the medicine. Also the American diet. I've been enjoying this food, but wow, Sugarland. Um, have there been, say there's these drugs coming into the brain, whether they're the drugs from the street or the drugs from the doctor, is there a lateralized effect at all? Has there been imaging studies on this or whatever?
Well, that's a good question. Very little has been studied about laterality. Uh, there was a researcher in the 80s who did some autopsy studies and looked for receptor sites in the two hemispheres, and he found that they were different. That there were differences in receptors that were lateralized, but it's not something that's been studied, and it's easy to study if you just do a baseline test like this, put a pair of goggles on the patient for a minute on one side and the other side, you can get a baseline measure of their hemispheric valence. And then you can do studies and you can interpret it from a lateral perspective. We published a paper suggesting that, but nobody's followed that. It's hard to get a new idea across.
Well, maybe if the results of these opioid addiction studies are profound and they're very obvious, that might spark the whole thing. I hope.
Well, I think that's a good question. I think whether fentanyl switches, the hemisphere. Like beer, the first or second beer might be helpful. The eighth beer that you're going to get to eventually is very destructive. And the same with fentanyl. That when you are taking 2 grams of fentanyl a day, you're in trouble. You can't work, you can't function, and your life goes down the drain. But people get addicted to fentanyl because it's a drug that's very good for trauma, and that's why people take it. But it causes a new trauma, so it's not a good drug. The side effects are too much.
Why is it good for trauma? I don't know about these drugs, so.
Yeah, I don't know why either, but it relieves the pain of feeling inadequate and scared and depressed and the same with oxycodone. I think that someone would sprain their wrist and get oxycodone, and they say, "Hey, this feels good," and because it's treating their trauma, and that's why I think it's caused an epidemic.
Maybe we could finish this off on maybe a little personal story. You don't necessarily have to get into your childhood traumas or whatever, but how has all this stuff, using it on yourself, helped you?
It's helped me tremendously, and so like if I'm under some stress, I'll use the envelope and I'll use the light on most days, and I think it gives me extra sharpness, and I think it's a sort of a cognitive enhancement. I think it might be good for sports enhancement, and it's helped me to talk with myself, and so I've been through a lot of psychoanalysis, and so I know my psychology well, and so I'm able to sort of combine it with that, and so it's helped me. And I would say that my psychoanalysis was very helpful. So I think a good therapy is really good, and I think this is an adjunct to good therapy and an enhancement for it.
It must really help with relationships too. I was actually explaining this to my girlfriend. As I was reading the book. Like, I got to finish this book. At first, I was like, I got to finish it, but then I was like getting really excited about it. Like, I want to finish this. This is amazing. And she was doing it, I was doing it. We're doing it together, and then it really helped because of course in relationships the the weaker side emerges sometimes, and you blame it on the person. But now I feel like she can understand, like, that wasn't Mike, that was Mikey or something. And and that wasn't her. Well, that was her, but it was.
Yeah, yeah, that's true. That's absolutely true. That it helps relationships, and you can have a kind of a four-way conversation going on. Yeah, and I have one couple that I do sort of couples therapy with. They both have trauma, and so they can help each other between sessions, and so they help themselves, but they also help the other person.
Like, there's four people, not just two. Once you realize there's four people here, not two people, it's like, okay, okay, that explains things.
Yeah, right. Yeah.
I think you were also talking about how it goes beyond that to groups of people, or maybe nations and companies and stuff too. And
Yeah. Yeah. I think you were saying before that the human race is so logical and sensible. But if we look around the world, we see all these wars and famines and genocide um, that the human being isn't as well as we'd like him to be. So, I think that this it has a potential to maybe improve the race, but maybe that's getting a little grandiose.
yeah, maybe you should send some junk mail or some light machines to the White House, to Russia, to Israel. Yeah. And the title of the book is Goodbye Anxiety, Depression, Addiction, and PTSD: The Life-Changing Science of Dual Brain Psychology. And yeah, excellent book. I think even just from listening to this conversation, people can get a glimpse of like how life-changing this could be, and you can feel it within seconds. But then keep doing it. I imagine it just gets better and better. I'm at the beginning of that journey, but I'm very excited to keep going down it. Um, if people want to connect with you or they want to learn more, yeah, they can buy your book. That's on Amazon and where books are sold. Where else can they go?
Okay, well, I have a website. It's called dualbrainpsychology.com. And they can email me directly if they want. It's fred.schiffermd@gmail.com. As I'm always happy to hear from people. And on the website at dualbrainpsychology.com, there's a link where they can reach me.
Are there any other people researching this or any other kind of resources or books aside from your stuff?
No, I have colleagues at McLean Hospital who work with me and have we've worked together over decades, and they've supported my research. And in the fentanyl study, they're running their separate site, and they're running half of the subjects, and I have a separate site where I'm running. We're both running 65 subjects, and they're also getting amazing results with the fentanyl treatment. Now, again, we haven't broken the code, and so it could be the sham people who are doing great.
Yeah. Any other books or things like that that inspired you a lot? They're not going to be specifically dual brain psychology, but they kind of build up to it.
Well, there is a book, I think it's out of print now, by Springer, on the dual brain review of the dual brain studies, and that kind of rekindled. I had studied it in college, but didn't really understand it. And I liked reading Freud, but Freud gets very ethereal, and he didn't have to answer to an editor, or he didn't have peer reviews, and so he could write whatever he wanted, and it's sort of poetic, and I enjoyed reading Freud, but what I'm trying to do is be more grounded and to support any statement that I make. And we have about 30 research papers. And we're the only psychological theory that comes out of rigorous science and is supported by rigorous science. But I don't have something really to recommend. Yeah.
No, that's actually perfect in a way. We already have enough things to do and things to watch and things to read. So get your book, and it's all going to pretty much be in there. You have another book, Of Two Minds, that was written in the 90s or something. So there's two's enough, I think. Well, thank you so much, Fred. Thank you for the book, and thank you for your amazing work. I'm looking forward to seeing the results of this opioid study, and yeah, hopefully we can heal these traumatized minds and countries and families and relationships. And thank you so much for this conversation, and thank you for all the work that you've done and continue to do.
And thank you, Michael. I appreciate it.